Hi, everyone. So, I want to start trying to do little mini series. This one is going to be called Sick of the System. It's going to be a series where we get real about what's broken in traditional healthcare and how we're doing things differently here in New Mexico Family Medicine. Today's episode is going to be called We Left the System to Care for You Better. And that's exactly what we did. We stepped away from corporate medicine so we could focus on what truly matters: patient care. First, let me say how grateful I am that you're here. My name is Stephanie Neufeld, and I'm a nurse practitioner and the proud owner of New Mexico Family Medicine, located right here in Moriarty, New Mexico. Today, I want to share a little bit of my story and why I chose to leave the security of big healthcare systems to open a small town clinic that puts people and patient care over paperwork. I spent years working in large healthcare systems, places with all the tools and technology you'd expect, but also far too much red tape. And while there were benefits, what I saw over and over again were patients slipping through the cracks. I remember one man who came in with chest pain, but was turned away because he couldn't afford the $140 to walk through the door. Another patient was misdiagnosed and overtreated when in reality, the symptoms she described were side effects from another medication she had already been prescribed. She wasn't just dealing with her illness, she was being treated for the treatment itself. In corporate medicine, I was seeing 20 to 25 patients a day. That left me with maybe 10 minutes per patient, and that included the time I was allowed to chart on that patient. There was no room for meaningful conversations, no room to really listen to what mattered. At New Mexico Family Medicine, we're doing things differently. We believe healthcare should be personal, it should be thoughtful, and it should be rooted in real relationships. You're not just a number in our clinic. You're a neighbor, a friend, a member of our community. And that means your time matters, your story matters, and you matter. I don't want to rush through a 7-minute visit. I want to know your story, your family, your work, your struggles, not just what's typed into your chart. Because a patient isn't just their blood pressure reading. They're a mom, a daughter, a rancher, a teacher. And when we treat people like people, not problems, we get better outcomes and deeper trust. So, thank you. Thank you for being here and listening to a piece of my journey. If you ever feel like the system isn't working for you, just know there are providers who care, who truly care, and who have built clinics like mine to reflect that. So until next time, take care of yourself and don't settle for anything less than the care that treats you like the whole person you are. Bye, guys.